Hypothesis. Your shoulder is your foot's puppet. Now, I know that sounds totally corny, but because of the way your fascial system works, things are so interconnected. And if you're having difficulty with your shoulder mobility, you might actually want to check out or test out some motion in your feet with the therapy balls. So we're going to do it's a magic trick, but it's not magic. It's the way your body is strung together. So just check in with your shoulders. We're going to do an external rotation and flexion test. So just skull over ribs over pelvis, externally rotate your shoulders and feel that you are at max external rotation. And then flexion. So for flexion, you'll bring your arms all the way overhead and then making sure that you're not shifting in the spine. So you can actually pack your ribs in a little bit more, Greg. Yeah. And then look up and see which hand is further back. And so it's just checking into that end range of motion. So what would you say? Is it even or one is further back?
I would say a little even, though the right might be a little further back.
Your right has a little bit more elastic range? Okay, so let's roll the left foot. So you'll take the yoga tune-up ball and we're gonna do just a few points. So one is the place right in front of your heel, which is the quadratus plantae, as well as the attachment site of your plantar fascia. So toes go on the ground, ball's nestled into your heel, and then you just lean some body weight into it, and in slow motion, you go from side to side. And so the idea here isn't that you're using your leg muscles to push the ball down, but you want your foot to kind of sludge its way across. So you can do that for maybe about 60 to 90 seconds. Point two is to then go to the transverse arch. So that's where all of your mid-foot bones converge into the phalanges, and so your toes drape over, and then same thing. You'll drag your foot side to side in slow motion, and it's gonna both warm up this tissue, also broaden the bones of the tissue, and remember, this is in service of the shoulder. We're just trying to talk to all of the structures in the bottom of the foot for a moment. Then keep your foot still, and your other foot comes on top. And this is for what I call the dorsi fascia. So now you want to use the stickiness of your right foot to move your left foot's skin and the fascia that's underneath it around. That might feel a little bit warm or burning. It's like trying to take off your foot stocking. And then our last move is to just cover all the bases. So you'll take your second ball and you'll bring it to that metatarsal area, the transverse arch. And the two balls are pretty close together. And then in slow motion, you'll slide your foot forward as the balls track backwards towards your heel. And you just want your foot to be super lazy and super sludgy. And really, we're just trying to peel open the width of the foot. Then you get stuck in place, and just for fun, you can wobble your heel from side to side. And then really, that's it. Then dismount, take the balls away, and then recheck. So you'll recheck by externally rotating your shoulder. And I'm already sensing I have more external rotation in that shoulder. And then bring your arms overhead and feel for if the range has changed. And so...
It has.
So, I mean, we're just messing around here in a quick, sort of stressful video situation. When you do this at home, you'll take a little bit more time. Of course, you'll do the second side and be in your body. Feel for those ranges. So... Is your shoulder your foot's puppet?
It's pretty much the foot's puppet. Amazing. And just make sure you take time to get into it, because it does connect.